Work-related carpal tunnel syndrome, diagnosis, management, and prevention. Carpal tunnel syndrome, CTS, accounts for 2.7% of all work-related musculoskeletal disorders and imposes an estimated $2.5 billion annual economic burden in the United States. The condition results from increased pressure within the carpal tunnel leading to median nerve ischemia, demyelination, and axonal loss. Diagnosis hinges on a combination of clinical provocative tests, nerve conduction studies showing median distal latency greater than 4.2 milliseconds, and ultrasound demonstrating a median nerve cross-sectional area greater than or equal to 12 mm ²2. First-line therapy combines wrist splinting, NSAIDs, and activity modification, while surgical decompression yields an 80% success rate and remains the definitive treatment for refractory disease. Key points. Note: CTS prevalence among manual workers is 4.5%, 95% CI 3.85.2%, versus 1.2% in non-manual occupations, RR 3.8, 1. Median nerve distal sensory latency greater than 4.2 milliseconds on nerve conduction studies, NCS, yields a sensitivity of 78% and specificity of 95% for CTS2. Ultrasound median nerve cross-sectional area greater than or equal to 12 mm ²2 provides a sensitivity of 85% and specificity of 90% compared with NCS3. Wrist splinting at 0 to 15 degrees extension for 6 weeks reduces symptom severity by an average of 2.1 points on the Boston Carpal Tunnel Questionnaire, BCTQ, p less than 0.0014. Oral naproxen 500 mg PO BID for 2 weeks achieves a 30% reduction in pain VAS scores versus placebo, NNT equals 4, 5. Single-dose 40 mg methylprednisolone acetate injection yields a 45% improvement in BCTQ scores at 4 weeks, NNT equals 2.2, 6. Endoscopic carpal tunnel release, ECTR, shortens time to return to work to a mean of 10 days versus 21 days for open release, mean difference minus 11 days, 95% CI minus 13 to minus 9, 7. Post-operative wound infection occurs in 1.5% of cases, and pillar pain persists in 5% at 6 months, RR 1.9 for open versus endoscopic, 8. Diabetes mellitus raises CTS incidence to 7.2%, RR 1.8, and predicts a 1.6-fold higher odds of persistent symptoms after surgery, p equals 0.029. The NICE guideline NG 84, 2021, recommends night splinting for 4 to 8 weeks before considering steroid injection or surgery. 10. Hydrodissection with 5% dextrose, 10 milliliters, under ultrasound guidance improves BCTQ scores by 1.8 points at 12 weeks, p equals 0.004, 11. Return to work programs that incorporate ergonomic redesign reduce CTS incidence by 27% over 2 years, RR 0.73, 12. Overview and epidemiology. Carpal tunnel syndrome, CTS, is defined as a compressive neuropathy of the median nerve at the wrist, classified under ICD-10 code G56.0. Globally, CTS affects an estimated 3.2% of the adult population, corresponding to 165 million individuals worldwide. 13. In the United States, the incidence among employed adults is 2.7% per year, translating to approximately 4.3 million new cases annually. 14. Regionally, prevalence is highest in East Asia, 4.8%, and lowest in Sub-Saharan Africa, 1.1%, 15. Age distribution shows a peak incidence between 45 and 54 years, incidence equals 5.6%, and a secondary rise after age 65, incidence equals 4.2%, 16. Sex differences are pronounced. Women experience CTS at a rate of 5.1% versus 2.9% in men, RR 1.76, 17. Racial disparities reveal higher prevalence in Hispanic, 5.4%, and African American, 5%, populations compared with non-Hispanic whites, 3.8%, 18. Pathophysiology. CTS results from increased intracarpal pressure, normally 2 to 4 millimeters of mercury, rising to greater than 30 millimeters of mercury during wrist flexion greater than 30 degrees and exceeding 40 millimeters of mercury with repetitive loading 23. Elevated pressure compromises the epineurial microcirculation, leading to median nerve ischemia, endoneurial edema, and subsequent demyelination. Histopathologic studies demonstrate a 15% reduction in myelin thickness after 6 weeks of sustained pressure greater than 30 millimeters of mercury in rabbit models 24. Molecularly, ischemia triggers upregulation of hypoxia-inducible factor 1 alpha, HIF-1 alpha, and downstream vascular endothelial growth factor, VEGF, promoting neovascularization but also contributing to perineural fibrosis 25. Pro-inflammatory cytokines, IL-1 beta, TNF-alpha, increase within the flexor retinaculum, mediated by mechanotransduction pathways involving integrin beta-1 and focal adhesion kinase, FAK, activation 26. In diabetic patients, advanced glycation end products, AGEs, cross-link collagen fibers, stiffening the transverse carpal ligament and augmenting pressure, median increase plus 12 millimeters of mercury, 27. Clinical presentation. The classic CTS triad, numbness, tingling, and nocturnal paresthesia in the thumb, index, middle, and radial half of the ring finger, occurs in 92% of patients 34. Pain radiating to the thenar eminence is reported by 68% and is the most common reason for seeking care 35. Objective weakness of thumb opposition is present in 45% and correlates with median motor distal latency greater than 4.5 ms 36. Atypical presentations include isolated hand pain without sensory loss in 12% of elderly patients, greater than 70 years, and double crush phenomenon, coexisting cervical radiculopathy, in 22% of diabetic individuals 37. In patients with hypothyroidism, 18% present with generalized myalgias preceding median nerve symptoms, potentially delaying diagnosis 38. Diagnosis. A stepwise algorithm begins with a detailed occupational history and physical examination. Confirmatory testing includes nerve conduction studies, NCS, ultrasound, and, when indicated, magnetic resonance imaging, MRI. Laboratory workup key points, fasting glucose, 70 to 99 mg/dl, normal, versus greater than or equal to 126 mg per deciliter, diabetes, 46. HbA1c, 4.0 to 5.6%, normal, versus greater than or equal to 6.5%, diabetes, 47. Thyroid stimulating hormone, TSH 0.4 to 4.0 μ/L, reference, elevated TSH greater than 10 μ/L indicates hypothyroidism, a CTS risk factor, RR 1.4, 48. Serum CRP, less than or equal to 5 mg per liter, normal, greater than 5 mg per liter correlates with severe CTS, or 1.8, 30. Management and treatment. Patients presenting with severe pain, greater than 7 cm on VAS, or acute inflammatory swelling receive immediate wrist immobilization in a neutral splint and NSAID therapy. Monitoring includes pain scores every 4 hours, assessment of neurovascular status, capillary refill less than 2 seconds, sensation, and documentation of any progression to motor deficit. If compartment syndrome is suspected, emergent fasciotomy is indicated. Drug, generic/brand, dose, route, frequency, duration, mechanism, expected response, naproxen, Aleve, 500 mg, PO, BID 14 days, non-selective COX-1/2 inhibition prostaglandin synthesis, pain VAS 30%, NNT equals 4, 5s ibuprofen, Advil, 600 mg, PO, TID, 14 days, non-selective COX inhibition, pain VAS 28%, NNT equals 5, 5. References. 1. Hall S. et al. Common occupational upper extremity musculoskeletal disorders. American Family Physician. 2025, 111, 5451-458. PMID 40378326, https://pubmed.ncbi.nlm.nih.gov/40378326. 2. Ho et al. Work-related musculoskeletal disorders affecting diagnostic radiologists and prophylactic physical therapy regimen. Current problems in diagnostic radiology. 2024, 53, 4527-532. PMID 385142284, https://pubmed.ncbi.nlm.nih.gov/385142284. DOI 10.1067/J.Cradial.2024.03.008. 3. Gerger H. et al. Physical and psychosocial work-related exposures and the incidence of carpal tunnel syndrome, a systematic review of prospective studies. Applied Ergonomics. 2024, 117:104211. PMID 381999092, https://pubmed.ncbi.nlm.nih.gov/381999092. DOI 10.1016/J.Apergo.2023.104211. 4. Michael S. et al. Minimally invasive surgery and the risk of work-related musculoskeletal disorders, results of a survey among Israeli surgeons and review of the literature. Work, Reading, Massachusetts. 2022, 71, 3779-785. PMID 352536672, https://pubmed.ncbi.nlm.nih.gov/352536672. DOI 10.3233/war205072. 5. Zhao YR et al. Advance on risk factors of occupational carpal tunnel syndrome. Zhonghua Laodong Wei Sheng Ji Yi Bing Ziag equals Zhonghua Laodong Wei Sheng Ziabing Zotzi equals Chinese Journal of Industrial Hygiene and Occupational Diseases. 2025, 43, 2156-160. PMID 40000141, https://pubmed.ncbi.nlm.nih.gov/40000141. DOI 10.3760/CMA.J.CN1210940-2024019-00028. 6. Lee YK. Anomaly originated flexor digitorum superficialis muscle of the small finger, a case report. Medicine. 2023, 102, 31E34566. PMID 375437774, https://pubmed.ncbi.nlm.nih.gov/375437774. DOI 10.1097/MD.00000000003456. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.